Dear Professor Ugo Carrara, dear Chairman, my name is Irina-Grishechkina. I am head of Department of Studying the Mechanism of Action Physical Factors, National Medical Research Center of Rehabilitation and Pulmonology. I would like to present my report, Thermal Medicine in the Treatment and Prevention of Chronic Respiratory Disease. Relevance of the study. According to a new report issued by the WHO and the European Respiratory Society, chronic respiratory diseases such as asthma, chronic obstructive pulmonary disease, and other lung diseases remain largely undiagnosed, poorly managed, and their burden of health system in the European region is significantly underestimated by the World Health Organization. Although chronic respiratory diseases are often preventable and treatable, they are among the leading causes of disability and death worldwide, particularly as underlying causes of cardiovascular disease and cancer. They are currently the sixth leading cause of death. In Russian Federation in 2023, respiratory diseases ranked first in the structure of morbidity among the adult population, accounting for 59,829.8 thousand cases. In the structure of disabilities, the number of people newly recognized as disabled with respiratory diseases amounted to 14,000 people. In the mortality structure in 2023, respiratory pathology ranked fifth and was the cause of 5,575 deaths. Today, the following methods of health resort treatment have the strongest evidence base for clinical effectiveness in respiratory diseases: climatotherapy, external application of mineral waters, internal inhalation application of mineral waters, physical rehabilitation techniques, exercise therapy, including Terencore, physical training, physiotherapy. These methods have both a therapeutic effect on the main pathogenic mechanism of the diseases and a preventive effect, reduced in the impact of risk factors. The first studies focusing on the optimal duration of health resort treatment date back to the 1960s. In the 200s, studies were conducted comparing the effectiveness of standard 21 days and reduced from 10 to 14 days health resort treatments. The results were mixed. Were some studies finding no difference in effectiveness and other finding the reduced health resort treatments had lower clinical effectiveness. Currently, there are no clear recommendations on the optimal duration of health resort treatment and rehabilitation at health resort organization for patients with respiratory diseases. Many recommendations on the duration of medical rehabilitation for respiratory diseases specify a period of 12 sessions. Aim of the study. The aim of the study is to evaluate the clinical effectiveness of health resort treatment in patients with respiratory diseases at different treatment periods on the 7th, 14th, 18th, and 21st days. Materials and methods included 300 patients, 100 patients with bronchial asthma, 100 patients with chronic obstructive pulmonary disease, 100 patients with chronic bronchitis, 2 examination points upon admission to health resort treatments and upon discharge 7th, 14th, 18th, or 21st day of treatments. Research methods. Clinical and functional methods, laboratory methods, assessment of external respiration function, assessment of heart rate variability. Heart resort treatments, climatotherapy, gall inhalation, therapeutic exercise for respiratory diseases, exposure of the lung roots to low intensity infrared laser radiation, and exposure of the posterior surface of the chest to a variable magnetic field mineral water inhalation. Duration of treatment is 7, 14, 18, and 21 days. Result. In patient with COPD, starting from the 7th day of health resort treatment, there was a statistically significant improvement in quality of life, a decrease in depression levels, and an increase in exercise tolerance, with these changes remaining of the 14th, 13th, and 21st days of health resort treatment. From the 18th day of health resort treatment, there was an increase in external respiration functional indicators, FEV1, FVC, TIFNO index, and on the 21st day of health resort treatment, there was a decrease in anxiety, a reduction in sympathicotania, and compensation of tension regulatory system according to heart rate variability studies, as well as a decrease in the level of leukocytes and ESR in a complete blood count. In patients with bronchial asthma, it was noted that clinical manifestation of bronchial asthma, attacks of suffocation, and the need for short-action beta-2 agonist, result of the asthma control test questionnaire, improved statistically significantly on the 7th day of health resort treatments. Physical tolerance increased according to the 6-minute walk test. And the ESR value decreased in the complete blood count. The trend persisted on the 14th, 18th, and 21st day of health resort treatments. From the 14th day of health resort treatment and on the 18th and 21st day, there was a statistically significant decrease in the number of patients complaining of shortness of breath and improvement in external respiratory function, FEV1, FVC %, as well as a statistically significant improvement in the quality of life of patient and heart rate variability indicators, statistically significant increase in total spectrum power and low frequency component power, and decrease in high frequency component power, stress index, and centralization index. And on the 21st day of health resort treatment, a statistically significant decrease in depression levels was noted. Thus, on the 7th day of the health resort treatments, an improvement in quality of life was noted according to health profile scale. And this trend persisted on the 14th, 18th, and 21st days. On the 14th day of health resort treatments, there is a statistically significant decrease in complaint of weakness and fatigue, an increase in saturation of quality of life according to the visual analog scale quality of life test, a decrease in white blood cell count and erythrocyte sedimentation rate, and this trend continued during the subsequent stages of treatments. On the 14th days of health resort treatments, an increase in hemoglobin is noted in complete blood count, and these changes continue on the 18th and 21st day of the health resort treatments. Conclusion. In light of the aforementioned dynamics of clinical and instrumental laboratory indicators of patients with respiratory diseases, it is possible to select the individual duration of the health resort treatment course, depending on the individual treatment goals of the patients: control of symptoms, improvement of general well-being, improvement of physical exercise tolerance, correction of external respiration function, prevention of future exacerbations. Thank you very much for your attention.